Bonjour. Je vais juste faire un test pour voir si vous m'entendez. Si vous pouvez écrire, si quelqu'un peut écrire juste un commentaire pour voir si vous m'entendez bien. Puis aussi pour voir si... Oh, I'm speaking French. I'm so sorry for the... so sorry for the English-speaking people. French is my main language, so it just felt really natural to go directly to English, to French. Okay, so we're going to be starting the webinar right now. I'm just trying to find a way to remove the things on the right to have you see, so you just see the slides. I'm sorry about that. Expand. So we're going to start in a couple of minutes. And could somebody tell me in the questions if you are seeing my own control panel? Okay, thank you for telling me that you're seeing only the slides. That's great, so I can feel like we can start. All right. So, control panel, perfect. So today we're going to talk about breast health and wellness. I'm Dr. Elise Dubois. I'm the chiropractor. I'm the head of structural medicine here at Sanoviv and started the department 6 years ago, and the head of the spa, and I'm trained in functional medicine. I've done the certification in functional medicine, and I'm a therapist in family constellation, for those of you who know a little bit about that work. So I decided to talk about the breast health, well, you know that October is the Breast Cancer Awareness Month, and I find that there's a lot of information on the medical aspect, the more conventional aspect, but we don't talk often about prevention and things that really make a difference. So October is the Breast Cancer Awareness Month, so in honor to this, I wanted to give you better tools to prevent breast cancer and guide you in making better choices, especially if you were already diagnosed with breast cancer or any other breast disease, fibrocystic breast disease. All of this you're going to get some tools. And I know that everybody knows at least one person that had breast cancer, so please share this information around. And this webinar is recorded, so you can certainly go on Sanoviv's website and listen to it again if there's information. I'm going to give you some exercise to do if some things were not clear and you didn't have a pad to write notes. You can go on the Sanoviv's website and listen to it again, or send your loved one, somebody that you think might benefit from that information. And you'll have access like this. You'll have access to all the other webinars that were recorded in the past. So this is, I wanted to show you a slide about the breast cancer cell doubling time, because all of us produces cancer cells in our body as we speak. Every second we produces cancer cells. But for most of us, our immune system will detect the cancer cell and it will eliminate it. As you see here, cancer is years in the making. Like after 90 days, you have 2 cells. After a year, you only have 16 cells. 2 years, 256 cells, and it goes on. And you can see that at 5 years, you already have 1 million cancer cells, but it still cannot be detectable by mammogram. And you have to go up to between 7 to 8 years of this process before the cancer can be detected and is the size of 1 centimeter. And it has to contain around 1 billion cells. So doctors in general will want to treat it like it happened overnight. And obviously, if they would know different, it would change the treatment options. But those results I show you were not embraced by conventional medicine in general. And honestly, it's in part because most doctors have never seen these results. So if you look at this chart, you'll think, wow, there's lots of time to intervene before having to go under the knife, do the drugs, the chemo, the radiation. And the answer is yes, there's lots of time to make a difference and change the course of action, but you have to be able to detect it. And this is where thermography comes into play. It should be considered a little bit like your crystal ball that will predict your future and will tell you your current breast health. So once you have that information, you can act on it. And the technique we use at Sanoviv is not just an image of the heat pattern on your breast like the image you see on the right. It's not just this image, because we're really testing your physiology. Because your physiology, the function of the cells, will start changing first, way before there is any anatomical change that can be perceived. It first starts with your physiology. So the physiology will really lead the anatomical change. It will guide the anatomical change. So how do we test your physiology? Well, we first take 3 base images, like the image you see on the right. We take 3 base images from different angles, and this will show any inflammation pattern that is present in the body. And then we put you in a really cold environment in order to create a stress response from your sympathetic system. So with the cold stressor, a normal function, somebody that has a normal physiology that functions normally on a cellular level, there's going to be a change because your blood vessel will start to constrict because of the cold temperature, and then the heat pattern will diminish on the image. So here you see heat pattern. I don't know if you can see my arrow, but here you see heat pattern. After we put you in the cold, the stressful event with the cold water, this should not stay as hot. If it stays this same color, it tells us that there's a change there in the physiology. It's been shown that cancer cells release nitric oxide around the area, and nitric oxide is a vasodilation agent. So it basically, your blood vessel won't be able to constrict and the heat will stay. So we basically take 3 images before, put you under a cold stressor, we take another 3 images. And then the medically trained doctor will analyze this and give you a plan of action to reestablish the proper function of the breast tissue. So when you have it's called a positive thermogram, when we find that the change is not happening like it should, we'll analyze the nipple area. If we find that changes are not happening, that's called a positive thermogram. And then we have a plan of action. So the thermogram are non-invasive. There's no use of radiation. There's no pain, no compression. So it's a really good alternative, and especially to find before the mammogram could detect any change. So the breast thermogram, like I told you, is testing your physiology. An abnormal thermogram is 10 times more significant as future risk indicator for breast cancer than having your mother or your grandmother have breast cancer. And then, as I told you, the scans are compared for vascular symmetry by measuring temperature difference between the areas of the breast. And a positive scan can indicate mastitis, benign tumors, fibrocystic breast inflammation, or early inflammation in the tissues that is not yet disease. It may detect cancer, small, big tumor, and that can be detected. So what really matters is let's do something about it, because true prevention is really detecting and intervening before there's any anatomic change. So, and those are things that the top the top 10 things that we do at Sanoviv to help guide you on this path. So manage daily stress, eliminate insulin resistance, and I'm going to go over each of these things. Assess heavy metal toxicity and any detox imbalances, prevent vitamin D deficiency, prevent iodine deficiency, relieve the lymphatic congestion in the breast tissues, eat a whole food diet, avoid environmental toxins, evaluate your dental health, and improve your lifestyle in general. So let's go over this. So chronic stress increases your body's cortisol production, which then increases the conversion of the hormone estradiol to estrone. So it will promote that change, and as a result, this increases the risk for breast cancer. So we're often very disconnected from our body and not even aware of how stressed we are. And I can tell you in Sanoviv, we have sometimes people that have meditated their whole life, sometimes many hours a day, and they have their own relaxation practice, and we put them on a biofeedback device that we use in the psychology area. And they're totally astonished to see how stressed they are. So it's about managing your daily stress, but then making sure you're effective with the tools that you have. So we use in Sanoviv this biofeedback device, and I'm going to give you an option that you can buy that's for sure a lot cheaper than what we use in Sanoviv, that you can use at home, a software that you can use, and once you can do your own relaxation practice and then go on this, connect yourself on the machine, and then see, am I being effective or not, and find what really works for you. So I'm going to share some of those tools with you. The fastest way to manage stress and go into a relaxation mode is deep belly breathing. It's fast, it's cheap, so it's definitely something diaphragmatic, deep belly breathing. That's something that's easy to do. You can be sitting in the traffic, in the car, and you just have to think about it. So just take a deep breath. And when you take the breath in, you should feel your belly pop out, like if you're inflating a balloon. And when you breathe out, your belly comes back in. I'm going to go a little bit over visualization. Find what works for you. Prayer, meditation, go out for a walk, find fun hobby. We have a lot of patients that come at Sanoviv, and when we ask them, what do you do for fun? They really don't have anything that they do for fun. So, this is part of healing. So deep breathing. Deep breathing will increase your energy, your immune response, which is a big deal if you've already been diagnosed with cancer, definitely have to work on increasing your immune response. It helps digestion. I'm going to talk a little bit about that later. Your metabolic functioning, relaxation, and your quality of sleep. Then visualization is another tool we use a lot at Sanoviv, and you can see it too as healing imagery. Studies with PET scan of the brain have shown us that the mind cannot tell the difference between something real and something imagined. So if it can't tell the difference, use this at your advantage. And in a day, we have a lot more thoughts that are negative than positive. So the process of visualization, for those of you who are not familiar with this, you need to create images in your mind that is as clear and as vivid as possible, and use all your senses: the sight, the sound, the smell, the taste, the touch, everything that you can stimulate in your mind to activate a nervous response in your body. It's kind of like you're telling your body, this is happening right now. So you can use this for relaxation. Visualize yourself in a peaceful environment, doing something you love, surrounded by the people you love. And if you've already been diagnosed with a disease, you can visualize yourself with healthy breasts, visualize yourself surrounded by the people you love, healing. If you're going through chemotherapy, you can definitely visualize yourself being healthy through chemo, without losing hair, without feeling sick. And this is very powerful. Your mind has a lot of power over the matter. So you can definitely use this tool to heal and relax. And those are two tools that you can use to measure stress. One is the M-Wave 2. It's a stress relief system, and that's one that you can use at home to really see how efficient you are with your practice, if you already have a practice. And if you want to go into having a practice, it's a really good tool to see how you're managing it. This tool, the M-Wave, you can buy online on the Sanofi store. We have this. And the adrenal stress lab test. This is starting on Monday. You guys are probably the first people to know about this, but starting next Monday, we're going to have an area on our website, on Sanofi website, where you can buy online testing. We're not going to have a huge option, but at least some of those that I'm going to talk about today, you're going to have access to those, and they're going to be shipped to your house, drop ship, and then you ship it back to the labs, and we can help with the interpretation. So the adrenal stress lab test is going to be one of them, starting on Monday for the U.S. and for Canada. It's not right now, but it's coming. It's coming soon. So look for this, because you can do a saliva test and check your DHEA level, which is a sign of your immunity function, your hormones function, and then check the cortisol to see how much cortisol is being released in your body. The second point that I want to cover with you, you have to eliminate insulin resistance. Insulin resistance is a huge factor in the development of cancer, and especially linked with breast and colon cancer. Those are the top two linked with insulin resistance. So on top of creating a general inflammation pattern in the body, the higher sugar in the bloodstream will feed the cancer cells. So when we have patients with cancer at Sanofi, we remove all sorts of sugar. Even the fructose from the fruits, we remove all sorts of sugar from their diet, and we focus on really, really low glycemic food. And that's how you're going to starve the cancer cell. The starving of the cells will then promote their apoptosis, which is basically those cells will die. So insulin resistance happens when someone has been exposed to high sugar levels and over again. And don't forget, I've put the alcohol here because people tend to forget about alcohol and how much sugar it contains. So it doesn't necessarily have to be candies or cake and stuff like this. You know, sugars, it's in pasta, bread, it's in the alcohol. So start being aware of this. And to really understand insulin resistance and the importance of it, you have to understand what's the normal function of insulin. Because I think insulin resistance, most people know that it's pre-diabetic phase, but don't necessarily understand what's going on. So I'm going to try to put it for you in a way that it's easy to understand. So normally, the sugar from the food that you eat will enter the bloodstream. Then the insulin will be released from your pancreas. And it's going to knock on the door of the cells. So it's like the insulin goes to the house, knock on the door, the house is your cells. The cell will open the door, let the sugar in, so there's not too much sugar in the bloodstream. So the cell will take the sugar in, less sugar in the bloodstream. That's the normal function. But over time, if the sugar load is high again and again and again, the insulin will go knock on the door, but the cell won't hear it. So that's when you start producing more insulin. So the insulin can start knocking louder on the door. And this is how the cell ends up resisting to the insulin, because it doesn't answer its call to open the doors and let the sugar in. So I hope this figure of speech kind of helps you to understand what I mean. So there's more and more sugar in the bloodstream, more inflammation. The sugar will create free radicals, which will create damage to the organs, and then it goes on like this. This is a perfect picture to develop cancer. So for prevention, it's important to make sure your blood sugar and your insulin are within an optimal range. And this you can get checked by with general MDs back home. You know, everybody, they don't necessarily always make the link with the cancer, but you can certainly ask for those tests. So choose a whole food diet that's low in sugar, that's moderate in high quality proteins and fats, really high in vegetables and fiber. And if you're eating meats, remember to select organic, hormone-free chicken, wild-caught fish, grass-fed beef, and avoid processed food and fast food. So that's about the insulin resistance. Then I'm going to talk about detoxification, because it's estimated that up to 90% of all cancers are due to environmental carcinogens, combined with the nutrient deficiencies that are needed for proper detoxification. So basically that means that giving the same exposure, those with the poorest liver detoxification system are more susceptible to cancer, and to cancer in general, not just breast cancer. So at Sanofi, we have various tools to assess the health of your liver and the function of your detoxification pathways. So let's go. This is a bit more complicated than the insulin resistance, but I think it's important that you understand how the detoxification happens in your body. Here you have the toxins. The toxins have to pass through detoxification in the liver to become water soluble and be able to be eliminated through the bowel or the urine. But through this process, there's two phases, and it's you can picture it as two wheels, the phase 1 and the phase 2, and they spin at a certain speed. So the first phase is run by enzymes in the liver, and the substance that's produced after it passes through this phase, the substance that is produced here, I'm kind of missing this information, but there's substance produced here that's even more toxic than the toxins at the beginning. And it has to be picked up by the phase 2, because if it doesn't, it creates a lot of DNA damage and free radical damage in the liver. So it has to be picked up by the second wheel, and then this step 2 is mostly guided. You need to have amino acids to be able to go into the step 2. So you know, when people say I'm doing a fast for detoxification, or water fast, let's say, well, it could make sense spiritually, you know, energetically to do a water fast, but if you really want to detox, you need to be giving those things, the vitamins and the minerals, and you need to be giving the amino acid to your liver in order to really be efficient at detoxifying. So keep this in mind, because sometimes fasting can really make you more toxic on a physiological level. Energetically, that's something else, but you have to keep this in mind and see really what you're aiming for. So the thing is, like I told you, those two wheels have to spin at the same speed. And because the things that will make step 1 spin faster are things like coffee, alcohol, and cigarettes. Most people drink coffee, and most people have once in a while alcohol. Cigarette is not as common anymore. But so this will make your first phase, your first wheel, spin really fast. And often your phase 2 will be a bit sluggish and won't pick up the pace. And the damage that's created during that time, that can be very bad. So we have to make sure you're getting all the stuff you need to upregulate your phase 2. So it's interesting too to know, I think here, do I have this here? Oh, well, metabolic end products, microorganism, contaminants, pollutants, insecticides, pesticides, food additive, drugs, and alcohol. And it's interesting to know that part of this metabolic end product is your estrogen. So I thought it was very interesting when I found out that my estrogens were being detoxed in the same way that drugs, pollutants, pesticides, everything that was foreign to my body was going through the same pathway. So you have to stop and think about this, because this means that our body has to be efficient at detoxifying our own hormones. And it matters nowadays because we are surrounded by estrogen. It's everywhere. So if you think about it, many people are taking the pill or taking hormones for menopause. So those people, even if you might not be making those choices, if a lot of people do, the hormones is in the urine, their urine goes into the water, and then you shower, you know, we're exposed to a lot of hormones now. You consider that most people don't eat organic meat, so they ingest high level of hormones through the meat they eat, because most the cows, the cattle nowadays, they're fed with hormones so they can grow bigger. So all of this comes into play. So plastic produces xenoestrogen, so that adds to the rest. So even if you're careful, all of those things will pass through the urine, goes in the soil, the water. So we're all exposed at higher level than ever before. And this is why now a 9-year-old will start menstruating, will have breasts and hips way before they should. So taking in consideration that we all have more exposure to estrogen, what really matters is how you detoxify. It matters, this matters. What are you putting in your body to make sure that you're processing the toxin, you're processing the estrogen? And the men too, you guys produce estrogen too. So the other thing you have to consider is you can have some genetic predisposition. So as I told you, those are mediated, the first phase is mediated by enzymes. So for some people, genetically, they're predisposed to have the enzymes being either too fast or too slow. And the same thing with the phase 2. You can have some genetic predisposition, which would mean basically that maybe all your life you have to supplement with N-acetylcysteine because you don't have the way to activate this pathway in your body. A way to know about this is to do a test. In Sanofi, we do this test. It's called Detoxigenomic, so it tells you your predisposition. Because you can be predisposed and be efficient at detoxifying because you're taking all the right nutrients. So this is important. If you want to see more the estrogen pathway of detoxification, you can do a test called estrogenomics. So those are things we do here in Sanofi. So the detoxigenomics helps you see your predisposition, but if you want to see how your body actually metabolizes estrogen, there's a test that's called Estronex. Estronex is a urine test that you will be able to buy starting on Monday from our Sanofi website, and it will tell you your level of good and bad estrogens. And at the same time, it kind of gives you a clue of how you tend to detoxify in general because it's the same pathways. So the good estrogens are the 2s. There's one of the 4. The bad estrogens are the 4. It will damage DNA. It's very cancer promoting. And the 16 encourages tumor development. So this ratio, yeah, that's me speaking French again. This ratio will be determined from the urine specimen. And if we will provide a consult after with this information, but you have to consume more food that contains like broccoli, Brussels sprouts, cauliflower, cabbage. Take some nutritionals. So, we help you with the interpretation of the test, but just for you to know that this is going to be available starting Monday. And the last important part of the detox process is how efficient you are at having a bowel movement, because the toxins are in the feces. And if they stay there too long, if you're constipated, you're not having regular bowel movement, this tends to be reabsorbed. And it goes and recirculate again in the bloodstream. It goes again through the liver. And each time it will increase the toxic load. And it's very common. The patients that we have that come here with cancer in general, they often have constipation and most of their life and probably thought it was normal. We ask somebody, how are your bowel movement? Oh, normal. But then you ask more questions and you find out it's one every 3 days. That's not normal. You need to have 1 to 3 bowel movements a day, ideally. So if you do have constipation, make sure you get good fibers, you have good hydration, exercise will will help promote the bowel movement. I'm a chiropractor, so I have to say get adjusted. L5 and all the lumbar area have an impact on the way you digest your food, the way you process in the intestine and the colon. So sometimes it's something that can be related with your spine. Drink plenty of water and do deep belly breathing. Deep belly breathing will have an impact on your diaphragm function and will create kind of this going up and down motion will create a change of pressure on your bowel and kind of create like a massage. So you can do deep belly breathing. And if all of this doesn't help, well, go do some enema colonics. You just need to get the toxins out of your body. And then keep promoting detox in general. Those are tools that you have to keep in mind. If you can, deep infrared sauna is a great tool to pull heavy metal out of the body. If you can afford a deep infrared sauna, go for it. We had a blog on our website, and I think that can help guide you toward making the right choice of sauna, because there's a lot of choice out there, and that blog should be good guidance for you. The lymphatic drainage, I'll talk a little bit more about lymphatic drainage later in the webinar, and I'll talk about it specifically to the breast. But for general lymphatic drainage, you can use a rebounding, those mini trampoline, do the dry brushing, do physical activity, and lymphatic drainage massage. That's a good way to get this moving. Hydrotherapy can be done at home, so you don't necessarily need to have a cold plunge and a hot tub. So just when you take your shower, after using the hot water, you turn the cold water on for 30 seconds and just hang in there. Then you close the water completely and just relax for a couple of minutes. And you can take that time to do your deep belly breathing, your visualization, all the stuff we're going to talk about today. Just make a routine for yourself. And then after a couple of minutes of just relaxing there, turn the hot water on again for a couple of minutes, cold for 30 seconds, and then you're done. You can do this twice and do it a couple of times a week, and that will promote the detox process. Physical activity will make you sweat, which it's really good for you, and it will move the blood flow faster, bring oxygen to the cells. So there's just good things about physical activity. And even if you have cancer, a lot of our cancer patients, they tend to just become sedentary with cancer, but there's a lot of research that shows how much physical activity is part of the healing process. But don't go overboard. If you've been running marathon, you keep exercising, but just don't produce so much free radical in your body and don't create so much charge for your body. Just go a bit slower, but keep moving. Well, we talked about the water. And think about getting exposure away from your body. So think about your teeth. Are they full of mercury? For those that haven't read the book of Dr. Wentz, A Mouthful of Poison, it's a really great book that can really change your outlook on all the dental stuff, the heavy metal toxicity. And if you're going to do the work, remove your amalgams, get them done by a dentist that's a holistic dentist that use a protocol, because removing the mercury can be more toxic than keeping it there if it's not done properly. So this is to keep in mind. Okay, another point. Now we've talked about the detoxification aspect. Now I want to talk about preventing vitamin D deficiency, because there's around 600,000 cases of breast and colorectal cancer that could be prevented just by raising their blood levels of vitamin D. So Sanofi recommends 50 to 80 nanogram per milliliter year-round. Even I live in Mexico, and even in the summer, I use vitamin D supplementation because, we work, we're not always outside. So, and vitamin D is one of the most important anti-cancer substances known to science. So that's to consider. And get out in the sun. Try to expose as much skin as possible without wearing sunscreen. In the past maybe 15, 20 years, there's been a lot of information out there about skin cancer, and people have started to wear a lot of sunscreen. And what this has triggered over time is your body, you'll inhibit the production of the vitamin D in your body. As soon as you use a sunscreen that has a SPF that's higher than 8, you stop the production of vitamin D in your body. So, you know, if there's area of your body that are very sensitive or have been exposed a lot and, you know, like your face, if you don't want to get more wrinkle and want to protect from the sun, you can use the cream with the SPF on your face, but just make sure other areas are exposed without the sunscreen. And for those that are in Canada or in the northern parts of the United States that don't have a lot of exposure to sun during 6 months or maybe even 7 months out of the year, there are lights that you can buy that's kind of a natural light box. Sometimes I would have my patient go into the salon and use the machines there, but not enough to burn. You know, that's really not the point. It's just enough time to be exposed to light. Sometimes you use supplements and you can't raise your vitamin D until you're exposed to enough light. So this is something you can consider. The other thing about vitamin D, you have to make sure that your cholesterol level is high enough. And yes, you heard it. I said high, not low. I said high enough because ideally your cholesterol has to be higher than 170. Because cholesterol is the base structure of vitamin D. And we sometimes have patients that are really proud that they've been on statin drugs and their cholesterol is so low now. Their doctor is so proud at home because they're around 130 or 135. But there's nothing healthy about having a low cholesterol. So people on statin drugs, make sure you don't go overboard. 170 is the lowest. So if you have low level vitamin D and you're not taking any drugs to lower it and you can't seem to increase it, well, you can increase the amount of eggs in your diet. That's a healthy way to raise your cholesterol. And sometimes it's not just what's in your diet. Sometimes it's how you metabolize it. So if you've been doing the eggs every day and you haven't been able to raise your cholesterol, you have to think of liver toxicity and do a good liver detox. Here in San Aviv, there's a formula we really like for liver support, and it's Hepacil. It's from USANA. USANA is a supplement company that was founded by our founder, Dr. Wentz, by San Aviv's founder. And we really like this this formula. We've done some research protocol with it, and we've seen how efficient it was at lowering mercury and lead in the blood in the body. By just taking Hepacil, so we highly recommend this one. So if you wish to know your blood level of vitamin D, you can go online on Monday. That's one of the tests we're going to have, and purchase a kit there. And aim at being between 50 to 80 nanogram per milliliter. And if you already have cancer, you need to be between 80 to 100. Now, iodine. Breast tissue is a sponge for iodine, and the use of iodine for breast health has been documented since the 1960s, where they could already link the deficiency of iodine with cancer. But yet, the conventional medicine doctors, they don't often recommend iodine for the breast, even if it's been recommended for a long time. And there's areas that you have to be really careful. There's areas that have very deficient soils. And if you look, I wanted to put a map of where there was the most deficiency of iodine and where there was the highest incidence of breast cancer, and it totally matches. And that area is all around the Great Lakes. So the Ontario, Wisconsin, all that area around the Great Lakes is where there's the highest incidence of breast cancer and the highest incidence of iodine deficiency. So studies have shown that the minimum amount of iodine to protect the breast of fibrocystic disease and cancer is 20 to 40 times more than what is needed to prevent goiter. So that's around 3 to 6 milligrams per day. The good news is that the changes on a cellular level, the histological change, can be reversed when you start reintroducing iodine in the body, and there's a clear effect of tumor suppression. So if you already been diagnosed with breast cancer, go get some iodine testing. Iodine has a very wide range of use. It has a high concentration in all the mucosa tissue. So you can use it as an antibacterial, antifungal for the sinus, for the intestines. You know, if you have Crohn's disease or ulcerative colitis, get some iodine. You can use it for bladder infection, fungus on the toenails. If you have very dense fibrocystic breast disease or cystic ovaries, it can be reversed within 3 to 6 months of supplementing with iodine. So that's a big deal, because right now in the conventional medicine, there's not much that they will do other than maybe giving you some hormones. So you have to be guided by a conscious healthcare provider if you're going to supplement with iodine. You have to get tested. It's also really, really important to note that individuals that are on thyroid medication, if you're deficient in iodine, you have an increased risk of breast cancer. So if you have some condition that require higher amount of iodine, you'd need to be guided by a practitioner. You can do a urine challenge test to check your level. This is the one we use at Sanoviv. It's a urine challenge test. It is safe for everybody to take between 1 to 2 milligrams a day of iodine. But if you're going to go higher, make sure you're guided. And increase your intake of sea vegetable, unrefined sea salt. This will be source for you of iodine. Shrimps have iodine too. So this I really wanted to talk about. So now the next tool, the next key is to relieve lymphatic congestion in the breast tissues. So avoid wearing tight bras or bras that have underwires. And I know it's hard to find because most bras have underwires but the underwires will mechanically block the lymphatic flow from the breast tissues. The lymphatic system is a circulatory system that helps rid your body of toxins. So to assess the lymphatic congestion, you can press your thumb inward about 2-3 inches below your armpits. I'll just repeat that again. If you want to check if you have lymphatic congestion in the breast, just go 2-3 inches below your armpit and just press there. And if you feel soreness, that's a sign that you can benefit from lymphatic exercises. So here I'm going to show you a few exercises to do on a daily basis to help relieve that lymphatic congestion if you feel that this is a problem, there's soreness. That's going to help promote the proper physiology in the breast. So these exercises you can do while lying on your back. It can be on a bed, outside, wherever you want. You can do it sitting on a chair, on the floor. And repeat each exercise gently 5 to 10 times, and don't strain your shoulders, please. So this is an exercise called the sweep. So you can do this in the shower, but obviously I was not going to take pictures in the shower. But you can do this in the shower. You put one arm over your head, and you sweep gently from your elbow across the armpit toward the collarbone. And you just do this 5 to 10 times on one side, 5 to 10 times on the other side, and use light pressure. If you use too much pressure, you're not going to get the lymph moving. You're going to be working more on a muscle area, but you're not going to get the lymph moving. So remember this. That's called the sweep. The second exercise I want to show you is called the pump. This one, I like to do it better when you're laying down. So maybe when you're still in bed in the morning, you clasp your hand together in the midline. You pump upward over your head. While you pump up, you inhale. And while you pump down, you exhale. And this will pump the lymph that's running from your breast to your armpit, it will get this moving. And you do this 5 to 10 times. And you see that this doesn't take a long, it doesn't take a long time. And if it can prevent having breast cancer, all those little tools, you put them together, make a routine. Now the angel, everybody has, well, everybody, not everybody, but everybody that lives up north, at least my people in Canada, they've all done some snow angel at some point. So you want to keep the palms directed forward. And when you breathe in, you go up. When you breathe out, you come back down. You do this 5 to 10 times. This will lift the lymphatic vessels that run along the side of your chest wall. Okay, so this is the angel. So another exercise that I want to show you to protect your breast. You need to know that all of those lymphatic vessels that we talked about, but not just them, all of the lymphatic vessels in your body, they all drain into the lymphatic duct. So the duct is like the ocean, no? So all the vessels are the rivers and they're all going into the ocean. Well, this lymphatic duct happened to pass right underneath the small pectoralis muscle, so part of the chest muscles. And a good way to know if these muscles are tight for you, you can lay it down on your back and see if your shoulders touch the floor. They should touch the floor and feel relaxed. But if they're kind of raised forward, raised up toward the ceiling, that means that the muscle is shorter because it's too contracted. So for sure this will block the flow in the lymphatic duct. So you have to, if you find that you have really tight small pec muscle, you have to make sure you stretch this muscle so it doesn't create a barrier for the lymph flow. So as you see here, you try to keep a 90-degree balance. Don't shrug your shoulder when you're doing this. And you can, I like to do this and massage at the same time. I massage the muscle from the insertion that's around here on the first picture to from the origin, sorry, that's around here, to the insertions that are on the ribs in this area. You can go all the way to the breast and just rub this massage. This time you have to rub harder because you're not moving the lymph. This time you're really trying to release the muscle. And you can use a door, open a door and just use the sides of the door to stretch both pec at the same time if you're busy. I like to do this in the shower too. And I put the hot jet right on the muscle that I'm working on. So the other thing, so those are the last exercise. I know that there's multiple, I've been showing you multiple things to do, but I'm giving you tools and then you can do what you want with the information. There's a set of lymphatic points that follows a half moon shape under each breast. And I don't know if you can see my little arrow, but it's right here on this woman. So you can massage each of these points vigorously for 30 seconds. One is the neurolymphatic for the liver, and one is the neurolymphatic for the stomach. So when it's very sensitive, that means it's congested. There's another lymphatic reflex point that's on the level of the nipple. So you need to lift the breast slightly to be able to access it on your thoracic wall. So you're kind of wanting to go at the level of the nipple, but don't go through the breast tissue. You want to go from underneath, you lift the breast, and then massage this point. Massaging this point will release toxins, and it will get the energy moving throughout the breast. So now we've talked about those neurolymphatic under the breast. Now you have the level of the nipples to rub. And the other neurolymphatic I want to show you is a small pec, and it's right between your breast. And it can be quite tender. And again, use the tenderness as a sign that you need to work on it. Well, actually, yeah, it's right between your breast, but use the guideline of between your breast when you're wearing a bra. You know, because if gravity has done its work, you might be rubbing your belly, and that's not the right place. So just make sure when you're wearing your bra, you find that spot, and it's very tender. And there's more. If you're interested in this kind of approach, there's a lot more exercise that you can do in energy medicine. I don't want to overwhelm you today, but if you're particularly interested in this approach, you can get Donna Eden's book. It's called Energy Medicine. And I even think she has one that's called Energy Medicine for Women. And it's on Sanaviv's website in the store. So now, whole food diet. Whole food diet is essential for cancer prevention. And I can't really push this enough. It's essential for cancer prevention. This means limiting or eliminating the processed, the convenience food, eliminating excessive amount of sugar. It basically means to eat closer to nature. Eat lots of veggies, especially those from the cruciferous family, such as broccoli, cauliflower, lots of sulfur food, like onions, garlic. This will promote the right detoxification because it will give you the support for that second phase we talked about. Include sea vegetables, unrefined sea salt in your diet so you can naturally increase the iodine, the trace minerals. Include color-rich berries so you have more antioxidant. You can add fresh spices like turmeric or curcuma. That's a powerful anti-inflammatory. You can add herbs like rosemary. Rosemary, it's a great support for liver detox. So just start thinking healthy with your eating habits. And there's key nutrients that are for breast health. We always recommend to take like a multivitamin, multiminerals. Again, in Sanoviv, we have a couple of options. We use the USANA Essential and we use LifeGuard Forte 2 for some cases of people, but the top nutrients that you can add to this for the breast health are turmeric, calcium D-glucarate, milk thistle. Milk thistle is in that formula that we talked about, the Hepasil. DIM or I3C, endolyl tricarbinol, that helps for the proper detoxification of the hormones. Vitamin D, iodine, those are your key nutrients for the breast health. And there's a lot more, but those, if you have to choose some, that should be your top nutrients. And avoid environmental toxins. And this is important for prevention of cancer, but also to prevent the cancer reoccurrence. So if you had cancer and you just did the chemo, the surgery, the radiotherapy, and nothing else, you really have to revisit your lifestyle. You really have to see what brought me here. Because when you treat cancer with chemo and all this, it's like treating an infection with an antibiotic. But cancer is not like an infection. The onset is not an infection. It's your lifestyle that brought you there. So you really have to revisit everything so that you don't get cancer again. Dr. Wentz and Dave Wentz wrote a book called The Healthy Home. And it really will help you to get all the information you need to know about what's in your household, what can be dangerous for yourself. And one thing that I forgot to talk about when I was talking about us being surrounded by estrogen, I forgot to talk about the fact that paraben is everywhere too. It's in the skincare, it's in shampoos, all the creams, and this will have an impact too on your hormones, your hormone levels. So try to find products that don't contain paraben. And at Sanoviv, we believe that the cure is prevention. So not only is it important to take steps daily to lower your risk for breast cancer, but if you have had breast cancer, really go revisit everything. Most importantly, you need to learn to love your breast. And I know it can sound weird for some people, but you know, they're all different. There's no perfect breast. And if you can't love them fully, you need to at least reach a point of being neutral about it. Because it's all about embracing your femininity, embracing the woman in you. And you know, the law of attraction is powerful. So beware of your thoughts like, I wish I had bigger boobs. Because guess what? Your body can hear you and grow some tissues. Or I wish I had less boob. Well, your body can hear you and create a situation where you have to get tissues removed. So be really aware of your thoughts. And ultimately, it's all about embracing your mother. And this is why I put a picture of my mom here. It's all about embracing your mother. And I can't finish the webinar without talking about this aspect because I'm a family constellation therapist, and I won't go into explaining what this type of systemic therapy is because it's quite complicated, to say the truth. But what I can say is that the founder, Bert Hellinger, he has documented various cases of breast cancer. And for sure, there are always some variants because every family system is different. But most of the time, there's an energetic pattern in breast cancer that the woman, consciously or unconsciously, it can be unconscious, but the woman would rather die than bow in front of her own mother. So the woman would rather die than bow in front of her own mother. And I know some of you might feel offended or even not really concerned, like, oh no, my mother's great, you know. But I just have to pass the information because working on the relationship with our mother is a lifetime work. So if the woman feels she's a better mother than her own mother, or she's stronger than her mother and kind of protects her own mother, or she's more successful and things like this, then it's a way of not recognizing our own mother like the big one and us as the small one. And this is what the breast cancer often represents. The cancer is the big one. And it's kind of giving you an opportunity to bow in front of your mother, even if she could have been the worst mother by society standard, like being abusive, addict, you know, things like this. But at the end, she has given you more than you could ever give back to her because she's giving you life. So part of preventing breast disease is finding ways to honor your mother and then connect with the earth, because that's the ultimate mother, is Mother Earth. So connect with the earth, go outside. So on this note, I hope you have found information that was that will be efficient for you to use at home. You know, you can really try to do a routine for yourself. If for you being in the shower works better, you know, just you stretch the pec, you do the pump, the sweep, the angel. You can do your visualization, you can do the hydrotherapy, all during the time you're in the shower. Just find ways like this so you can be efficient and preventive and protect your breast. So I don't really know how we are on time because I don't have a watch with me. But if you have questions, oh, you have question. I'm just seeing this right now. Okay. Oh, I see your photo, just a slide. Okay, so you mentioned several nutrients. Okay, so let's go over some questions. So you mentioned several nutrients required for detox. Are there sufficient amounts in the USANA supplements to cover this? Well, if you want to have the essentials, if you talk just about the essentials, if you want to take just the essentials, you can be okay if you don't have predisposition. Like if you're genomics, everything is fine, but sometimes you need extra. So it's kind of safe to recommend taking the Hepasil. The Hepasil have the N-acetylcysteine. It has other factors. In the essentials, there's broccoli extract. There's things like this too. That's like a whole food part of the essentials that will be supportive of this. So if you're taking the Hepasil and the essentials, I think you're covered on that part in terms of detox. I know that USANA is looking into raising the iodine level in the essentials, so maybe you don't need to take extra. But for all the other the other nutrients, I would go for extra. But in part of the detox, you can be safe with this. So I hope this answers your question. Okay, how does soy play into the extra estrogen factor? Well, see, that's an interesting question because, well, soy is part of. I'm gonna tell you our position in Sanofi. Everything that can be. Everything that has both, you know, when something has been documented and recognized as very positive and there's nothing that goes against it, we will apply it. But when something like soy is so controversial, we tend not to recommend anything related with soy. There's some good things about soy, and there's some bad things about soy. So soy will increase your estrogen load, but sometimes people that are in menopause, they need to have extra estrogen. So in this sense, it's good. You know, in this sense, you can do the phytoestrogen and be safe, because, but you have to make sure you're taking good care of your liver at the same time. Because estrogen is important for your sex drive, for a lot of you enjoying life. So you need to have good level of estrogen, but you have to look at, once you're in menopause, you have to look into your adrenal function, because normally you should transition. Your body was made to go into menopause, you know, so you should transition smoothly into menopause and not need extra help. And when menopause hits you like a brick wall, that means that your adrenals are not doing their work, because adrenals produce hormones too. And so your body is made that once your ovaries stop the hormone production, your adrenals are there to keep producing some levels. So when you have a lot of symptoms, that's a sign that your adrenals were so depleted that they were not able to pick up the pace. So that's when I would recommend you go and look into adrenal tests that we're going to have on Monday. So just be careful on this level. Get your Estronex test, and then you can see, because the soy can help promote the right detoxification of estrogen. You just have to be careful of how the rest of your liver is functioning. I hope this answers your question. Then Celine says, how much in milligrams should we take vitamin D per day? I can tell you in units, international units, and milligram. I'm not sure, because we don't work in milligram with the vitamin D here. You can take and be safe about taking 2,000 units a day, 4,000. I go up to 5,000 in the winter, and then get it tested. And if your vitamin D is lower than 30, you can do higher amounts, like 10,000 units a day, and then get it tested again, and just keep up with the supplementation. Honestly, the vitamin D, there's so much good things about vitamin D that it's not even worth thinking, oh, I'm at the right level now, I'll stop supplementing. So I'm sorry, I can't tell you exactly in milligram. All right, so if there's not any more questions, I can only thank you for being there, and I will see you maybe next month. Hopefully you can connect on the webinar again. Thank you, and have a good day.